I'm Dr. Paul Wong. I'm delighted and honored to be here with Dr. Byron Lee from the University of California at San Francisco. So Dr. Lee, maybe for the audience, could you describe what the study is intended to do and how it was structured?
Well, the wearable cardioverter defibrillator has been around for a while, and there certainly is a lot of observational research suggesting its benefit, but there really hasn't been any randomized controlled trial, and this study is the first randomized controlled trial of the vest. And so we took the vulnerable population who are post-MI, EF less than 35%, who are known to have a very high risk of sudden death, approximately 5% based on the Valiant study and the Ephesus study. And we randomized them to vest or no vest, and what we found was impressive. We looked at our primary endpoint, which was sudden death and ventricular arrhythmia death, which was negative. However, we saw an overall mortality difference of about 36%, which we thought was very impressive.
There are very few things in our field that have been shown to reduce overall mortality and due to sudden cardiac death, and this is really an important observation overall. Maybe you could just share with us, what do you think the implications for clinical practice? How will the clinician take this information and then change their practice every day?
Well, I think this adds to the evidence that we already have that the vest is efficacious and that it works. I think that when we're confronted with patients who we know are at risk, particularly patients who are at risk for a temporary amount of time, like the post-MI patient, that this would be a reasonable option. And I think it's still an option that requires discussion with the patient. Not everybody can handle the vest or wear it comfortably, and so I think it ought to be a shared decision making.
Great. Do you think many of these individuals will go on to get implantable defibrillators? Is that your speculation?
We've already looked at recovery in this population. So these are all patients, as I mentioned, who have very serious heart attacks, EF less than 35% to get into our study. And we found that about half the patients actually improve their EF, but half don't. And so the expectation is about half the patients will go on to get an ICD 40 to 90 days post-MI.
Wow, that's an amazing impact. That's a huge number of patients that have myocardial infarction. Could you tell us a little bit about the usability of the vest and inappropriate therapy? Is that a concern, compliance with the vest?
Well, we actually had good data on compliance. Turns out that the vest monitors wearing time, and it sends that information back. And so we saw that approximately 20% of our patients couldn't wear the vest at all. They tried it and just didn't feel comfortable with it and stopped wearing it early on. On the other hand, the other 80% of patients wore it quite reliably. In fact, on the days that they wore it about 22 hours per day. And so that's very good. That means they were following directions, which is to wear the vest except for bathing.
That's wonderful. Now, this is obviously a trial. Do you think it really represents what we can do in regular practice? Will we get this degree of compliance? Do you think people will agree to have a wearable defibrillator for this duration?
If you do shared decision making, you can probably find patients who are more likely to comply, more willing to try it, more willing to put up with it. But we found that a fair number of patients can do it, and I think the majority of patients can do it. And because it's doable, I think it's something that following an MI, a lot of patients are willing to do to protect themselves.
Yes, I would underscore, and now that you have such outstanding results, patients will probably seek this therapy as well, because they'll understand, as you explain to them, what the potential benefits are, that they may really say, oh, this is really something that I want to commit to.
Our patients are pretty savvy. They know what's out there, and they read and keep up with it, and I think there are a fair number of patients who will be happy to have it, are glad to have it, are relieved to have it. In fact, one of the interesting unexpected findings that we saw was that the patients who had the vest reported less shortness of breath. I would have almost have guessed the opposite, but they felt less short of breath, perhaps because they felt the security of the vest itself.
No, that's great news. Now, I know in your study you included patients that had revascularization as well as those who do not. How do you feel that the trial results cover both of those groups?
Well, the overwhelming majority of the patients in our population had some sort of revascularization. Most of them underwent PCI, which is the standard, I think, for most countries, you know, for patients who are having an acute MI. So I think it definitely applies to them. I don't think that we saw much difference in the non-revascularized people, but a lot of these kind of subgroup analysis we're doing now.
As you know, revascularization is often felt to reduce the risk of arrhythmias, and so to be able to still show overall benefit in terms of mortality is exceptional.